You must be careful about the words you use, or the words you allow to be used in your house. Words are things. You must be careful. Careful about calling people out of their names, using racial pejoratives and sexual pejoratives and all that ignorance. Don't do that.
It's time to talk about it.
Pull up a chair and take a seat.
We're serving up recipes for life.
With Hampton University's Dr. Richard Mason and Dr. Tamara Williams.
Welcome to the Sunday Brunch.
This is Dr. Tamara Williams.
And this is Dr. Richard Mason. Welcome to another edition of Sunday Brunch with the Good Doctors. We are right back at the table with you.
Yes, indeed. Yes, indeed. It's a good time to be at the table, too.
Yes, it is. Yes,
it's always a good time to be at the table.
Listen, anytime we got a chance to eat.
Hey. Say so.
Listen, let me tell you something. Panera is going to be a whole problem for me right now.
With this soup, this dollar soup that you can add to, we're giving them free advertisement. I don't understand.
Listen, let me tell you something. That grilled cheese with bacon over there at Panera, good God from Zion. When I tell you, it's going to be a problem for the rest of this winter season. You hear what I say?
No.
Yes.
No.
Yes.
It's worse things to eat. It's worse things to eat, but I'm glad we're here at the table to have a good meal today.
And that cookie, the kitchen sink. The kitchen sink?
The kitchen sink cookie?
You need to try that kitchen sink cookie.
They put everything in the kitchen sink in the cookie.
Listen, try the kitchen sink. It's going to bless you. Trust me it's going to bless you.
We'll have that conversation.
You try it, and then we're going to talk about it at the
table. Maybe we'll have the meeting at Sunday Brunch over there.
That'll work. That will work. All right, y'all call the people from Panera and tell them we need some sponsorship dollars.
Yes.
Since we done gave them some free promotion.
I promise you, we have never done that before on air. So, indeed.
All I'm gonna say.
So you must be hungry. Yes, you must be hungry because you having this food conversation early on Sunday Brunch.
Listen, because I can smell that bacon right now, and I know there's not a grilled cheese on the buffet waiting on me. But that's all I could think about.
We can fix that. Yeah, we can do something about that. I love grilled cheese too.
Yeah.
It's like one of my favorites.
Yeah. I like them. My wife, she likes them with that tomato soup, but
I don't like tomato soup.
No, I don't either. It tastes like hot ketchup.
I like a lot of red things, but not that one.
No, tomato soup tastes like hot ketchup. She's like, no, not the tomato basil. No, it's hot ketchup with basil. That's what it tastes like to me. I
like grilled cheese though, but I like it with tomatoes too. And mayonnaise. Whatever.
That's a whole problem. That's another issue.
We're going to keep this conversation moving because we have so many things to talk about today.
Listen.
I do mean we have so many things to talk about today. Good stuff. A conversation that we've semi-had. Like every time we come to the table, we always talk about some underserved populations. We always talk about mental health. We always bring that awareness to the table. And we've had a conversation about some of this population slightly. We've had people on the show who belong to this population, but we haven't spent enough time. And I know this is like our first show of Black History Month, our first entry. And we historically have had some challenges.
Yes.
We have historically had some challenges, and some things are often due to circumstances that we find ourselves in. So I wanted to make some space at the table to have one of those kind of sensitive conversations.
All right.
And see, we have someone at the table who we've had at the table before, but to see what kind of solutions she may have or suggestions she may have for those who have to live in those realities and deal with other people who live in those realities.
And we definitely need some answers and some solutions, that's for sure.
Because we're sharing some realities that we don't always want to play a part in.
And with this population, it's always a challenge because sometimes you live in a place where you don't know whether or not to say anything.
Out of respect, right?
Right. You don't know what to say, because you just don't know how people are going to respond to you. And some people will look at you like, well, we know what happened. We heard what happened. We kind of know what goes on and all, but realistically, you don't. You really don't. We can always thank them for their service and everything else or whatever, but the reality is, what do we really know?
And what does that mean?
Mm-hmm. Mm-hmm.
And when you do serve, what happens after that, mentally? So that's why I wanted to have that conversation, because there's a lot of people who are called to service, and that's an awesome calling, and we definitely need people to do that. But we also got to take care of the people when they return.
Exactly.
And they don't often return the way that they go.
No, they don't. And especially depending upon the time period. You're talking about whether or not you actually get an opportunity, and maybe that's not the right way to phrase it, but if you find yourself in a wartime situation, or you have to have some type of fire, or friendly fire, whatever you want to call it, with other countries or whatever we're dealing with, or whatever, wartime situations.
And even if you're not at war, but just the thought of it, like sometimes when I think about like PTSD and things that can happen, sometimes it's not even like you experiencing, but witnessing it in other ways too.
Right. That vicarious.
The stress, yeah. The stress of even the anticipation of what could potentially happen.
Mm-hmm. And sometimes just the training that you have to go through.
That part.
Always living life on edge. We talk about
That part.
that traumatic experience. I was thinking about that the other day too. I wonder if kids today get chased by dogs still. Because, as you talk about the whole trauma piece, that's
dogs still run.
But you said they still run.
Yes.
maybe it's just me that don't run.
Right. Yeah, dogs are still dogs.
But I was just thinking about, because I always, as I talk about trauma and what happens in the brain, and PTSD and stuff like that or whatever, the reality is it's likened to being chased by a dog, because when you look at how that amygdala takes over your entire system, and begin to think, your amygdala is
that
really
fight or flight.
Exactly.
Yeah.
And just imagine going through life always on edge in that fight or flight mode. And unfortunately, some of our members of the population we're going to talk about today, that's what they're dealing with from the whole training aspect, just being prepared to live on edge. That amygdala is always firing, and we have to work on that.
That sounds like good conversation to me. So I want to welcome to the table, before we have a whole conversation between the two of us, I want to welcome back to the table, I should say, Dr. Veronica Barnes. Tell our listeners what your actual job title is, so they can know how you work with our population, our veterans that we're talking about today.
Okay. So thank you for having me again. What I am is a psychiatric mental health nurse practitioner. So with that, I service the veterans at the Hampton VA Medical Center. I work in Connect. So Connect is a department that gets veterans established who are not established with a provider yet. So it's a walk-in clinic Monday through Friday from 8:30 to 3. With that, veterans come in once they're enrolled in the VA, and pretty much they come in, we assess them, get them established with a provider, place a consult for that, and start meds if warranted, or if just, a lot of times we live in a high military population, so a lot of times they're just retiring, just getting out of the military, so they just need a quick transition from being active duty to being retired. So we take care of all of that in one setting and then get them placed with a provider for ongoing basis.
Now, is this a new program?
No, I've been there 5 years, and before me, I think it was probably there for about 3 years. So it just gets the veterans connected smoothly to have a smooth transition. So you just walk in, you don't need a referral or anything. You walk in, again, it's a few of us that work in the department, and we assess you and get you going.
Who would then come? Who would send them there? What type of issues would make someone want to potentially come and see you?
So one of the things, so I'll say in reference to how veterans get there, it's different ways. Some, they just call the VA. They call the main number, 757-722-9961. They'll call the main number, and they'll say, oh, well, just walk into our walk-in clinic. Some don't know. Some, I get veterans
When you think clinic, I'm thinking like maybe health clinic. So how do they know that they need to go to the mental
health
aspect?
clinic.
Yeah.
So they may call in to the main number, and with that, they'll say, "Oh, well, we have a walk-in clinic." So that's one way they'll find out. Some just word of mouth. A lot of times they'll walk into one of the other neighboring clinics. So we have CBOCs around the area. So we don't just have the Hampton VA. We have community-based, I don't know exactly what the acronym is, but it's community-based VAs. We have Portsmouth, Chesapeake, Virginia Beach, and Elizabeth City. So a lot of times veterans will walk into those clinics, say, hey, I want to get established with behavioral health. And in those clinics, they have behavioral health. They also have primary care, but you have to come to the Hampton VA first to get established. So it's multiple different ways that veterans find out about us. We don't always know.
You don't always know.
We don't always know.
They show up,
But
and
they
say,
show up.
I need help,
And that's what we're there for.
Okay. So, what type of things or concerns do they typically come with?
A plethora, like you said, PTSD, anxiety, depression. It could be anything. Just want therapy, just want to talk. Like you said, we get things from concerns when veterans have gone in boot camp to retirement. So we get just a plethora of anything. Anxiety, depression is just pretty much one of the main things. I mean, you service our country and you see things that people on a regular basis don't see. So, and deal with a lot of things from boot camp all the way till retirement if you're blessed enough to be able to do that.
I don't typically hear people talk about at retirement wanting to seek those type of services. So I'm glad to know. I know it's necessary, but I'm glad to know that that is an option as well.
Definitely. If you've served and you're actually a veteran, then you were able to come.
Yeah. But like some people like retirement, I'm going to go off and take off to Florida and just, relax. But no, like.
Well, whatever has been a problem is always a problem
Even when you retire. Exactly.
Until you get some treatment from it. And a lot of times older veterans were not able to seek those services of behavioral health. It was taboo. You went, you're in trouble. You can no longer serve. No one wants to give up their career, so you have to suffer in silence with anything that you were suffering with. I mean, from military sexual trauma to discrimination to whatever it could be, a lot of times older population had to suffer with that. Now it's more talked about. You can go seek services while you're active duty. It wasn't always the same. So we get from very young to very old. I get a plethora of ranges of ages. Is no one size fits all, but everybody most of the time is dealing with something. And just even having therapy to talk to someone every once in a while is a good thing.
It's a great thing.
Mm-hmm.
How is mental health being managed in the military? Because like you were saying, just a minute ago, that taboo subject, that's the thing that could get you eliminated from a job. In some aspects, it might disqualify you from even coming into the military. So how is that seen now?
So I'm not too sure about how it is when you're in. I just know that it is more accessible now. I work in the community also, so I had a young lady who was thinking about her future. She's in college, and she was like, hey, if I don't, just planning her future. And she was like, well, I may go into the military, but I was told that I have to be off of behavioral health medications for 2 years before I go in. I said, well, I don't know. I think you should speak with a recruiter to ask them that. I said, but I do know most of the time that there is a certain amount of time that you have to be off medications. That's not necessarily helpful.
Especially if you need said medications, which is why you were taking
it.
Right.
Yes. So that is still to be worked on in reference to that. And while you're in, I see plenty of veterans come out that have been on medications, what their struggle, or if they had struggle getting there. Sometimes we hear that it is a struggle to get there. Sometimes it isn't a struggle. But what I see more now that it's okay. But I still also get where veterans are like, oh my God, I can't take this. It's my security clearance. We live in this high population area, so a lot of times when veterans retire, they go work at the shipyard. Again, you have to be cleared mentally to go work in a lot of these jobs. Most of the time, someone has a clearance. They're not trying to lose their money. They got families to pay for. So it's so many things to think about. You have to think about your mental health. You have to think about your job. You have to think about, is this going to become a problem later? So that is the things that a veteran has to think about. They have to think about, am I going to lose a security clearance? Am I going to...
A lot more stress.
Yes. I've had people walk out. I've had people walk out like, who can have access to my records? One of the things, and we all know with behavioral health records, I tell them these are like Fort Knox. It's not like your primary care notes, but if someone really wants to get them, if they really have to have them, or if you really want that job, you're going to give them up. So that is definitely what a veteran has to think of, security clearance. And
I know a lot of veterans, just talking to some of my other colleagues and all, I know a lot of military personnel, they would come in and pay out of pocket versus using their insurance benefits. Using TRICARE.
To not get tracked.
Exactly. And that's the thing. It's a matter of, although medical records are private, but when you're looking at clearances for certain things and they see that, oh, wait a minute, you've been billed by such and such mental health and associates. The issue becomes then, well, what were you seeing them for?
What were you doing?
What was going on?
That's a whole new conversation about stigma because it's not just the labeling, but it's the effects of that labeling. Which is sad because ultimately your health is the most important thing. Your health is the most important thing. And when you wake up in your physical health, you pray that you come with your mental health as well.
Right. And sometimes when people finally get stable, I remember years ago having a young man who in high school had finally got himself situated on his medication, got it all together and everything and whatever, and decided probably a year or so after high school to go into the military. And I remember him coming back into services saying he wants help balancing himself outside of medication because he couldn't be on medication for his diagnosis, and it was attention deficit disorder. And he said he couldn't be on medication going into the military. And that was my first time experiencing that. And so, of course, we had to, do some behavior modifications and all, and went on a holistic vitamin regimen treatment. But there were some things that he really had to do in order to get to that place where he could really function without his medication. And there were some deficits there.
And how safe is that? When you think about, that's like saying, you know what? Don't take your heart medicine. Don't, but
But I think it's looked at as a medical condition versus your mental health, not realizing that some of that heart medication can cause other issues in your system more so than what your medication, your psychotropic drugs can do for you, So, I was just amazed by
it's
that whole...
It's really challenging when they have to choose what they want to do.
It will
how
make
you want to move forward.
Disclose information that is very pertinent for their health and the safety of other people as well.
Definitely.
And I remember, at one time you were seeing quite a few situations on the news, on some of the talk shows and things of that nature. And this was some time ago about some of the veterans coming home and hurting their family members, thinking that they were
still at war.
Exactly, in a combat situation, and you wake up and your spouse is beside you battered and bruised. And you're thinking that you're in a war zone or in a situation like that, and yet your spouse doesn't want to seek help because it could damage, the person's career.
And it's something just as simple as taking Prazosin at nighttime to help you with nightmares. I mean, there are simple things that should not affect you in in just your everyday life. But again, if you're dealing with anxiety, if you're dealing with depression, if you were in a combat zone and now you have that severe PTSD, you have the hypervigilance, you have all of those things that come with that. You don't sleep. You have lack of sleep. What's going to happen if you have lack of sleep over and over and over and over again? Is just a habitual thing that continues to just snowball, and it can never get fixed if you're taboo about going. Again, if you are scared of losing a security clearance, is just until you are able to seek help or until you're willing to accept help is just a bad situation.
And the sad part about it is you might want the help, but you're afraid. And like you said, because when you think about just simple life situations of being able to take care of your family, lost wages and things like that or whatever, you're having to choose. And unfortunately, it puts others around you at risk as well. If I want to make sure that, Dr. Williams over here taking her medication, making sure that we are all safe in here.
Everybody's good.
Let me be clear. I am not on psychotropic medication. Not that I knock those that need it. But just in case you were tuning in at that moment, I want to make sure that we are clear. We laugh and joke, but the truth is there are a lot of people who do need help, and they do, and it's not always something that you may need for a long period of time.
Exactly.
There may be periods of your time that you need that help and assistance to help you get over that hump, or to make recovery and mental health recovery specifically doable. Doable for some people, and that worries me and concerns, because I know there's some people in certain diagnoses where they don't work well without their medication,
and you don't want to be around those folks.
You don't
want to be around.
Now you have weapons, or now you're in situations where I need you to be alert, or I need you to be aware, because here we are at combat, or I need you to have my six. I need that to happen while we're out here. So I can imagine how challenging this becomes.
Well, just overall, behavioral health is taboo. It still isn't out of that place. So even one of my patients that I had recently, a young lady, again, college student, is doing well on her meds, but she's like, okay, but in the future, I don't want to be on these meds. I say, well, we need to stay in the present. We need to stay right now. Like, you're okay right now, right? Yes. I said, well, don't think too far about that. But I said, we can discuss it, and we can discuss, okay, what it feels like to come off that, because this is your body. You have the choice to come off meds, and it's my choice to educate you on how to properly do that. So we had a discussion. Hey, textbook says, be stable on your meds. You're stable. If you're dealing with anxiety and depression, you're no longer having those. You're stable. Take them for a year. After that, of being stable for a year, then we can come back and readdress it and see about coming off your meds. If you come off and you're good, you're good. If you come off and you get depressed, have anxiety again, then textbook again is likely lifetime to continue to take the meds. But I say, people don't complain about taking vitamins every day. You taking this stuff and they ain't even FDA regulated.
Right.
I mean, we just pop stuff all the time. So I said, stop thinking about that one little med that is keeping you stable. You're focusing on the future. Focus on your present. Focus on your now. But behavioral health is so taboo. Even though she knows the medication is working for her, she's ready to get off.
She does, just like I quickly said, I'm not on that. A lot of times people, they have that stigma attached to it, or that shame that they're afraid that people will not understand what that means, or they will read more into it than what it is.
Especially different cultures. Different cultures are they're just not going to fare well with it. It's taboo. of course, in the African American community, behavioral. Oh my goodness! You better go to
Brown
church and pray.
communities in general, yeah.
You better go to church and pray. Yes, we do that too. But sometimes you need a little extra.
Right.
Vape without works. It's
It's dead.
That's right. But tell folks they need Jesus and a therapist.
Yes. Amen. And maybe some meds.
Right, exactly.
A little bit of sprinkle of it all.
That's it.
And that's okay. And I think that's why I really wanted us to have that conversation today. Is because people need to know it's okay. It's okay to not be okay.
It definitely is.
And to get some help.
And we have to normalize that because as much advancement as we've had in mental health, we have resources, we have opportunities and all that. People can live full, productive lives.
Extremely productive.
Exactly. It's not as if, years ago where people were just checked into
A mental facility.
Exactly.
Yes.
Or even to a place where the medications had you in, a zombie-like state. Because that's one of the things I know people constantly talk about when the issue of medication comes up.
That's what's in their head. Oh my goodness, I'm just going to be spaced out. That's what they think.
Right. And even though some may start a medication, because I know sometimes dealing with parents who end up having to choose the route of medication for their children that maybe, have attention deficit disorder, the question becomes, they're not the same. Well, technically they're not going to be the same on the medication because the medication is doing what it's supposed to do. However, you have to look at the normalization of their behaviors and maybe tweak and make some adjustments. If this medication is making that child a little more sleepy, a little more in that zombie state, then that child may need a lower dose. And that's how you have to just constantly work with your prescribing practitioner to make the adjustments and do the work. And the work involves documenting the behaviors, when they occur and all, because sometimes instead of just a regular release, you may need an extended release or a slow release. So you have to be willing to do the work. And I know I talk with parents in the same vein and explain to them that pill is just not a magic pill. You still have to do the work. You have to document so that your prescriber can know what's going on at what time. What time do you take the pill? And you have to be consistent. Give that pill at the same time every day because guess what?
Only not just the days when, you know how they do it.
Exactly.
Only the day that we're in school. So when they're off, out of school for spring break or they stop. You're like, you cannot do that.
Exactly. And trying to explain that to them, sometimes that's the hardest piece because they do think it's a magic pill. I can give it to you and it's going, that's it.
You're just good. No, it takes more than that.
Right. You still have to do the work. Whether you decide to take a behavioral approach or a medication approach, you still have to do the work. And sometimes that means tracking, the time that you give the pill. When do the behaviors occur? What are you seeing? Because if the medication isn't lasting throughout the day, like I said, you have to do that extended release, or change the time that you're actually giving the medication. When does a child's behavior begin? Is the child able to function first thing in the morning? Well, give it to the child at lunchtime, So it's a lot to this.
More forthcoming about what is actually happening because sometimes things are not working because people are misdiagnosed because they are not clear. They're not sharing the right information with those who are trying to help in the system. So I'm always encouraging people to just let them know what's happening. People can't help you. If you go to see a doctor, you have a rash on your shoulder and you don't tell them that, they can give you something that can make that worse because they don't know that part exists. So being honest.
And honestly, that's what happens sometimes. And that's why we see kids who are misdiagnosed. A lot of times kids are diagnosed with attention deficit disorder when that child is actually depressed.
That's what I was about to say. A lot of times, because anxiety and depression go together, a lot of times they are just depressed. And then the depression or the anxiety precipitates the other one, and you're thinking that they're just have a deficit problem. No, it's more than that. And if you treat that, perhaps then the attention part will be resolved.
Exactly, because parents, come in, the medication isn't working, Okay, well, let's see what's going on, because if a child truly is diagnosed appropriately with attention deficit disorder, that medication is going to do what
It's
that
gonna
medication is supposed to do.
It's going to work.
Right. And when it's not, let's start looking at some other things. And I know oftentimes we as adults don't want to look at the problems that we bring on to our children. And when that depression is there, we don't want to admit that, hey, guess what? As a parent, we are the problem.
A large chunk of
Definitely.
it.
Right,
Yeah.
exactly.
A large chunk of it.
Yeah.
Even how you problem solve. You teach your children how to solve problems, not just by what you say, but they watch you too. So they're
yeah.
working through these maneuvers as you are working through these things, taking in all these things. They see what you say and what you don't say,
Right.
what you do and what you don't do.
Yeah.
We all know they're mockingbirds. And they like to say
And
what
they
we don't
have a
want
better
them to
memory
say.
than you do sometimes. You're like, I didn't say that. They're like, let's get a playback.
Yes.
Exactly. You know, I'm gonna leave him nameless, but a famous comedian said years ago, and people got upset. He said, if you follow an ugly kid home, an ugly person gonna open the door. And people got upset when he said this because
Because you started with ugly.
Exactly. But the mindset is children are a product of their environment.
The apple does not fall far from the tree.
That's it. Apples and trees, you know.
It will
But
bear
that's
the
it.
fruit
That's it.
that it should bear.
Right. And so we have to really look at that when a child is coming to school with certain problems or certain behaviors. We really do have to look at what's happening at home because some of it can be organic, you know, and biological. However, that child got that DNA from somebody,
Yeah.
okay? Or the behaviors are
The
there.
learned behavior.
Exactly. Learned or something that's going on at home, you know.
A response to their environment.
Right, and unresolved situations. You know, like I said, kids who've come in and they've been misdiagnosed, when you start looking at what was happening at the time this child was diagnosed. Oh, wow, grandma died. Pop died. Mom and dad are divorcing. You know, so that child has had 3 different situations in their life, and you basically were dealing with those situations and told the child, you sit there till I get my life together, and then I'll deal with you.
And that does
And
not work.
sometimes the parents are not dealing with the situations.
No.
And their children are learning that as well.
Exactly. And so we really have to look at those things. And those are also the things that we take into adulthood. And so when we don't have those unresolved issues in our childhood, whether it's trauma related or not, but when we don't resolve those mental health issues as children, it takes us into adulthood as messed up adults that need services.
Generational traumas. We create those things.
Yeah. And we have to fix it. We just can't sit idly by and think we're going to get through this. No, you
It don't work that way.
No,
It's not that easy.
You need help, you know, and that's something we all have to admit. At times, we all may need to sit, as folks always say, Doc, I need to come sit on your couch.
Yeah.
We all need to sit on the couch at some time or another. At least to have that confidant or have a friend or somebody that we can at least begin to express this stuff to.
Absolutely. And I'm a big proponent of those who need even the group aspects of dealing with people who have issues. So if you know, like veterans who are coming back with PTSD, their families need support groups. They need to participate in the support groups so they can get assistance in understanding how to
Understand. So many times veterans come in, first of all, this happens all the time. My wife told me I had to come. When I see a lot of men, that's one of the main things. My wife said I had to come. I said, okay, sir. Well, you here. So what do you think? Well, I guess I got a little bit of problems. So that's a lot of times how it kind of starts. But
He coming to keep peace in the house.
yeah,
I wanna stay
he
married.
want to
My
stay in
wife.
that house. He want to
Wife
stay
said,
in that house.
if I want to stay in the house,
He want to stay
I don't
right
fit in
there.
that doghouse.
Yeah, so a lot of times, and that's another thing that we offer, we do have chaplain services for veterans and their spouse. So, because a lot of times the spouse does not understand. They just know that this person I married that I love went away, came back, and did not come back the same person. And I love this person, but how do I keep my peace and my sanity with whatever they may be going through? So, like you said, a lot of times it's a whole learning curve for everybody. Children, so many times I have, and it's sad that veterans I don't have contact with my kids anymore. I was mean, or whatever it was. It just
or
didn't
they may not
work.
have developed those relationships with them. Being how many deployments did you have? How long were you gone? And so,
And that's
they
a
miss
lot
quite
too.
a bit too. Yeah.
And then when they come back, they don't know how to get in line with what the wife, the spouse may have been doing with the kids all that time. So now they're even distant just because of that, because they don't know where to fall in place. They've been deployed.
They don't know the names of their
Teachers,
their kids,
so many
friends,
things,
or
yeah.
the teachers, and those type of things.
Yeah, so that's a lot for a veteran to come back to. Is a lot in that process for them to take care of themselves, still take care of their family, and you're just taking this person and putting them in they're used to being in the military. That's what they're used to. Being at home, a lot of times, that's not their normal. So you're putting them back in this environment that they're not used to, and now they have to
new
adapt. And it's hard because they're just adapting with themselves, trying to maneuver this new world, whether they've served 20 years or serve 10 or whatever it is, a lot of times they're having to readapt, and that's very difficult.
Well, I would say I would like to say that because of technology, some things in terms of the family unit has gotten better. Because I remember years ago when people were deploying, the only communication they would have with their deployed service member was through letters in that capacity. But now when you have access to Zoom and things like that or whatever, the accessibility is a little bit better. So it makes it a lot easier, if easy is the right term, to interact with your family while you are deployed and overseas versus through just simple letter writing, because that's always the issue while you're out to sea or you're away on deployment. Whoever the parent who is still home with the family unit, whether it's a husband or a wife, they have a new routine. And so when the deployed person comes back, how do we now interact with dad saying this? Well, Dad, we don't normally do this. We typically will eat pizza on Tuesdays.
And imagine how that has that dad feel or mother feel.
Yeah.
That's a crush. I'm like, I don't even know what to do. Where do I fit? Let me just go sit in this corner over here.
Exactly.
And then that, again, anxiety, depression, whatever, some type of adjustment disorder, then there that goes, because I don't fit in here. This is my family. I know you guys, but I don't fit in here.
And that's exactly what happens. I remember...
And the disciplining.
Yeah.
I've seen that happen too, where they're like, wait a minute, you have not been here to discipline me. Now here you are showing up with all these rules and whatnot.
But even what I was going to say, I have a mother who deployed. She came home, and something as simple as doing her daughter's hair. Her daughter said, no, Daddy doesn't do it like this, and she... basically took it apart and went to Daddy, and Mom had to come in because Mom was like, I'm feeling some kind of way.
Oh, yeah.
In a lot of ways, yes.
And and it was interesting because we had to talk about this, because typically it's Dad who's out of the picture, when it comes to deployments. But the mother was in this situation, especially with the little girl. Dad usually does the hair, and this is what Dad normally does or whatever. And now Mommy's home, and wait a minute, Mommy, this isn't right. My hair usually looks like this. So Mommy's feeling some kind of way. And fortunately, she had the wherewithal to say, I'm feeling some kind of way. I feel myself on edge, getting angry, because what I cook isn't something that they like. It's not what they're used to now. And I'm thankful that my spouse, he's able to cook and clean and do the girl's hair. But what does that, they don't need me, and so really having to show her how to maintain this relationship and how do you work this family thing during deployment and when you come back.
How to accept that role change, and what does that mean for her as a woman, and how she defines herself as a woman. The same way as a traditional role, if a man came in and the kids were like, "I don't feel safe with you here, Dad. I feel safer with Mom." He might be like, "Wait a minute, here I am.
You're gonna feel
I
some
think
type
I'm
of way."
supposed to be the one that's keeping you safe on that traditional outlook." So I can imagine, just those different layers too that adds to things with women being in service and being away from their children.
It's a big challenge.
It definitely is.
I'm very thankful for our men and women in our armed forces because they really do sacrifice a lot. And I don't think
And their families.
we as a people truly appreciate.
We don't.
I'll be totally honest because sometimes I hear people complain about jet noise, when it happens, or other things that may occur that involves the military. But I'm thinking to myself, how sad would it be if they were not here to protect our freedoms? So I'm thankful that I can sleep knowing that someone, as they say, has the watch.
Is roaming the skies.
Exactly.
I said it all the time with my dad. He recently passed, and he was in the Army 28 years. I'm like, I could not imagine you as a black man in Vietnam. Starting there, what you dealt with all those years that you didn't even talk about.
Because you could not talk about it.
He definitely couldn't go to nobody's mental health. That was not even a thing for him. And I'm just like, the things that you dealt with and that you conquered, that is just 28 years in the Army, in Vietnam wartime, and behavioral health. What is that? First of all, men, at that age, they were not doing that at all. I'm not talking to nobody.
Right.
Like, there's nothing wrong with me. And to have the accessibility now where you can actually be able to express your feelings. I can't think of exactly what it's called, but I recently had a veteran who says there are programs out there with veterans, while you're active duty, that is kind of off the record. You can go in and speak with a therapist, but there's no records being kept. And so they can get this stuff off their chest. This was the first time I heard of this. This was recently. And I was like, oh, so there's no records being kept. It's kind of like off the books, but you're able to express yourself and get some feedback back. So I don't know if that's something new that's kind of out there or if something that's been around, but I was recently told that, and I was like, okay, off the books, all right.
I just hope that it can be on the books, and that we can move in a way that we can have mental health be on the up and up and out in the open. Because when we can see things, we can better address things. And so hopefully we can keep having these type of conversations to, open up that awareness of, let's just talk about it.
Definitely.
And I think the more that we tend to fear the things that we don't understand and the things that we don't know about. And so I think the more we can know about these things, the less we can fear. And when we don't have to fear those things, we can address them head on.
And I think you hit the nail on the head when you're talking about just things that we fear and we're afraid of. We can't explain it, and we don't understand it. For years, you think about people in, especially African American families, you knew something was wrong.
And it's still wrong.
Right.
And it was just the normal for that person. That's just them.
Yeah, that's their personality.
That's just how he is. Something strange about Uncle Pete, but guess what? We're going to leave Uncle Pete alone.
Right.
And we don't do anything about it.
Nothing.
But those generational curses, they come. And it doesn't go away. You can't sweep it under a rug. And
it's going to pop out.
It's going to come out. It's going to manifest in some type of way. And if it doesn't manifest with you specifically, it could be your kids. It could be your grandkids. We do know that these things travel through our bloodlines.
And that's why we certainly have to normalize this thing. We have to normalize abnormal behaviors so that we can address them. When we see something that's different, when we see something that doesn't quite sit well, and even with ourselves, when we start having these bad days, and it's like, wait a minute, I'm having more bad days than good. What's going on here? Acknowledge it.
I say you have to wake up every day and just say, I'm gonna have a good day. You actually have to advocate for yourself. You have to be a hostage negotiator to your own mind and say, look, we're not doing this today. Today's gonna be a good day. We're gonna push through this. You have to advocate for yourself because so many things happen on a daily basis. You conquer one thing, like, okay, I know this is gonna be good. Next week, this is gonna be past me. But then next week
It's already waiting on you.
and it's something else. So you have to have good coping skills to just deal with life, just in general, coping skills.
Oh yeah, and resilience. I mean, that's the key. And I would say COVID really brought us face to face with ourselves because we had to sit in the house with ourselves.
And others.
Right. It's the others that we had.
And others. And some people have some others within themselves. Right. So
Yes.
Right.
yeah, you have to acknowledge that.
Yeah, we really did. We had to really look at that as an issue because now we're dealing with the behavioral challenges and stuff like that or whatever that came about because of COVID and just being stuck and no place to go, it kind of exacerbated us emotionally.
And socially.
Yes.
Socially,
Some people
emotionally.
liked it, though. Some people are
I'm not
mad
gonna
because they
pretend.
came out. And I've had that. I liked it. I enjoyed COVID. I didn't have to communicate with anybody.
There were a few moments that I was in my place, of
Yeah.
my element of peace. I tell you. Yeah. For those of us who are really introverts, it was a comfortable spot.
Definitely.
From the waist
I
up.
can identify. Look, I can identify.
Right. For those of us who are introverts, it was nice in some ways. Yeah.
Yes.
But we have to make sure that everyone, finds themselves in a place where they can speak on these things. You know what I mean? And that's what I think, like I said, we started seeing more and more virtual options for counseling services and things
Such
of
a
that
blessing.
nature. So I'm not a huge virtual counseling person, but for those that need it, it created options and avenues.
Yes.
Okay.
I mean, they allowed us to cross states, cross state lines for
Right.
what? How many years?
Right.
They allowed, so they know that works is needed if need be, because that was never a thing. I mean, it was a thing, but it wasn't as prevalent. But now, people are like, I'm at my house.
Yeah.
Let me tap into whatever this program is. Go on my phone, and the thing about it, if you're dealing with anxiety, if you're dealing with depression, a lot of times that doesn't allow you to go out the house. So if you have access to someone to come into your home to at least give you some type of services while you're at home until you can get out the house, that wasn't always an option. So definitely COVID had good and bad things, and allowing telehealth for so many people, that definitely was a blessing and continues to be a blessing. A lot of times when someone's given the option, okay, virtual may be a sooner appointment than a face-to-face. Look, just give me whatever the first available is.
Right.
And a lot of times it may be virtual versus a face-to-face. So definitely having those options are definitely a good thing.
So I'm thankful because I do believe, and by no means have I done any research just yet, but I would like to say I think more people are getting the help that they need, or at least inquiring about the help that they need. Because, I mean, here I know we're seeing more patients come through the doors, and we're getting more calls about services. And I'm hearing the same thing from other colleagues, that they are getting more referrals in their practices as well. And for those people who have chosen to do virtual, those folks are booked 8 hours a day, all day. They shut one Zoom down and they're on to the next, and so I would like to say that more people are seeking out mental health services, and so therefore it's somewhat becoming normalized to get help. But it also shows that we recognize that more people still need help.
Definitely.
I think it's the anonymity that allows people to also jump out there. They feel the safety that people won't see them going into these services.
Exactly.
They are able to invite someone within their home without actually opening the front door. So there's some aspects to that, but also I see it also as a way of masking.
Yeah.
But I see how it's helpful. Yeah.
And see, that's my thing when it comes to the virtual option. I do see that as masking because guess what? If you're sitting in front of me, I can see the nonverbal cues better when you're sitting on my couch. When
I can smell you.
Right,
Yes.
exactly.
And your body odor
Yeah.
differently
Yes.
in person than through a screen.
Yeah, you can see
Even
if
though I can
someone's
see
sweating.
disheveled through the screen, but there's certain things that face to face, will never be able to.
Right. You get
Correct.
the full view of that person. You know, when you're on a screen, they can hide a little bit more.
Definitely.
And so that's why, like I said, I'm not a huge advocate for it myself in terms of providing that service. If it's needed, sure. But I don't want to discredit anyone who finds that to be a viable option for them because at least they have the opportunity
That's
to talk
something
to
is
someone.
better
some help.
than nothing.
Right.
Yeah, absolutely. Absolutely. And I'm sure it has saved many lives. I'm quite sure. Just in that opportunity, having that social connection, even for those who have problems connecting socially. So.
Yeah. So definitely for our veteran population, I would say if they can't get into Project Connect at your office, at least be able to connect with someone. You know, there are a lot of virtual options out there as
Oh man,
well.
a plethora. You open your phone during COVID, they were all popping up.
Right,
They
exactly.
were popping up everywhere.
Yeah, as a matter of fact, you would get the messages, do you need to talk to someone? And I'm thinking to myself, I probably do.
Right, yes. We all. That's the part I would like to just normalize is we all could benefit from having someone in our life who provides you with a safe environment to discuss your feelings, because your behaviors are reflections of your feelings. And so we can only control those things within
Right.
ourselves. So everybody needs someone who's invested in them specifically. Because as people, we tend to care a lot about other people. Sometimes it gets enmeshed in some things, but being able to like really understand yourself, that is invaluable.
Right. And finding those people, even if you cannot bring yourself to going in for therapy, finding someone that you can have conversations with, as they say, keep it 100.
That will tell you the truth.
100, as they say, keep it 100. But that can really talk to you and
Yes.
really say, no, this you a whole problem right now.
Who will tell you no?
Exactly.
No, and not just be yes people in your
Right.
life.
Yeah, you don't need those people.
Exactly. So if you have someone that you can talk to that's going to keep it real with you.
It won't talk about you when you talk to them.
Exactly. Because sometimes
That's
folks,
the thing.
look,
That's
folks
the
just there to
thing.
get a report sometimes.
Yeah.
You
No.
know.
You gotta be careful.
I tell people, please find a professional, because if you couldn't hold it, don't be mad that someone else could not hold it. You told it first. And so there are people out there who are, that's their profession, to not go around telling
And to
what
not
you,
judge you.
Yes,
Right.
yes, that part.
That's
that
the
part.
thing. People will judge you and they will hold it against you. Just wait. You tell your personal business to somebody that's, not a
You
professional.
told it first. You're going to hear it again.
Don't be mad
Right.
when it come back.
Right.
And it never comes back the way you sent it. I just want to put that out there.
No.
Anybody who's ever played the game telephone knows that it never comes back.
About a second person is jacked up.
It never comes back the way you put it out there. It started off with the sky is blue. By the time you get to the end of it, everybody has had a relationship with this person and that person, and nothing about the sky at all.
Exactly. And the other part is just making sure a person is not going to weaponize your words.
That part.
Yes. That's that judging. That judging
And
part.
using it against you. But will help you, figure out what's the best part for you, how you can show up in life as your best self. And that's the best part about therapy. It's so focused on how you can become your best self.
Exactly. Because the reality is with therapy, a lot of times people think that, their lives are going to change and they'll forget about what happened. It's like, no, you're not going to forget. The brain is too powerful to allow you
Therapy
to
is
forget.
not amnesia.
Exactly. Exactly. Therapy,
That's a new one.
Therapy allows you to live even in your mess. You know, and that's the reality of it all. You know, how to live while you're going through certain situations and all. And so sometimes coming to therapy, you're going to feel bad before you feel good because you're having to relive some traumas and some situations that you've been dealing with. And so being able to do those things and all. And so I know that's usually during the first appointment, I let clients know that, you know, you may experience some trauma. You know, coming here is not going to be that feel-good moment all the time. You know, that's why I have tissues on my table. You know, you're going to cry, and it's okay. You might get angry. You know, you're going to run the gamut of emotions possibly, but that's a part of the process to get to the other side.
We need all of our feelings, and they're important. It's not our feelings that get us in trouble. It's what we do with them.
Yeah.
So, like,
Our
just
actions.
not understanding them. And I try to help people understand how to express different emotions, because sometimes people are really just caught up in the one or two that they know. And we have so many. We have so many, and understanding how to move past those. We get stuck in our feelings.
Exactly. So tell us this. We like to give little nuggets. You know, what are some things, or give us one or two things you would say to a veteran out there that may be going through right now? You know, what would you say to them about, you know, coming in for services and all? How would you encourage them?
I would encourage them by just come in, because either someone's going to force you strongly to come in, or either it will get so bad that you can't hide from your thoughts. Your thoughts are there. Say it all the time. Your thoughts, we can say to ourselves all the time, God, okay, I'm good. I don't want to think. Let me go to sleep, whatever it is. But our brains are powerful. And they go to deep, dark places where you don't want them to go a lot of times. And so just start. And I say all the time, get started with someone. You don't have to necessarily get along with everybody you meet. It's okay. Ask for another provider. That's one of my things. You don't like everybody you meet, so you may not always like every therapist you see, and vice versa. I say vice versa.
Right.
Everybody got to get along.
Right.
So I say always advocate for yourself. If you have someone and you don't fit well, you're not going to tell your deep, dark secrets, so you're not going to get anywhere. That's one thing. So ask for another provider. I don't care where you're at, what kind of care you're receiving. If you don't get along, you're not gonna move forward. So just come in, just seek services, see how it works, and it's gonna go from there.
All right, y'all. Y'all heard from Dr. Barnes. Simply stated, just do it. Ain't that the nugget?
Just
do it.
It doesn't
All
have
right.
to be more complicated than that.
Exactly. Well, we've had a good time at the table today, so thank you so much for being with us.
Thank you for having me again.
All right. Well, I am Dr. Richard Mason.
I'm Dr. Tamara Williams.
Thank you for joining us right here on WHOV Smooth 88.1.
The essence of HU.
Keep you full.
Someday we'll be able to measure the power of words. I think they are things. I think they get on the walls. They get in your wallpaper. They get in your rugs, in your upholstery, in your clothes, and finally into you.
Thank you for joining us at the table.
Tune in next Sunday at 1 p.m. for more delicious topical recipes for life on the Sunday Brunch.
On Smooth 88.1 WHOV.